Hello friends and welcome back to PADASHETTI'S Pulmonology. Today is Clinical Pulmonology Part 2 and today we are going to study regarding signs of COPD, the remaining signs of COPD. Coming to the today's first sign, that is Hoover's sign. You all might have heard Hoover's sign in various different pathology of different organs, but here we are going to study mainly regarding Hoover's signs of the lung. So what does it exactly mean? Hoover's sign means that there is a paradoxical inspiratory indrawing of the lower rib cage. Okay, there is a paradoxical inspiratory indrawing of the lower rib cage. As you all know, during inspiration, the lungs, the chest wall moves outward and upward. Okay, it moves outward and upward. But here in Hoover's sign, it's moving inward. So what would be the reason? So as you all know, like before understanding this region, like before knowing exact mechanism behind this, we need to know something known as zone of opposition. Okay, please follow my cursor. So what is zone of opposition? As you all know, the diaphragm is a curved structure, and here comes the lateral rib cage, or lateral to the this one will be the rib cage. So the diaphragm which is opposed to the lateral rib cage, that zone is known as zone of opposition. Zone of opposition of diaphragm towards the rib cage. Okay, you can all see here. This you can see this is a diaphragm is a curved structure, and this is a rib cage. See, the diaphragm is attached to the respirator from here to here. So you can see this is a zone of opposition. Okay, the part of the diaphragm which is opposed or which is contact with the lateral rib cage is known as zone of opposition. So in COPD patient, as the diaphragm is flattened because of the air trapping, so further further movement downward during inspiration causes the rib cage, lateral rib cage, to move inward. It will suck in. Okay, normally what happens, the diaphragm is opposed. Okay, it is curved configuration, but during COPD patient it is flattened. So on further contraction of diaphragm, there is a loss of zone of opposition. As there is a loss of zone of opposition, it further tries to suck in the lower rib cage. So it causes the inward indrawing of the rib cage. Understood? See, zone of opposition, lateral rib cage. When the diaphragm is flat, the zone of opposition is lost. So this diaphragm further tries to goes down. When it goes down, its attachment will be there to the rib cage, that will further suck in. Because of that, there will be indrawing of the lower rib cage. But how do you demonstrate it? Okay, how do you demonstrate it? As you can see here, during inspiration there is a inward sucking in. Okay, during expiration, see, it's moving out. Okay, means it's paradoxical. So we call it as paradoxical indrawing of the lower rib cage during inspiration. Okay, it might be prominent in upper rib cage also, but it is more evident in the lower rib cage. You can see during inspiration there is an indrawing. During expiration there is an outward. So how do you demonstrate it? You can appreciate by placing the finger over the costal margin in the anterior axillary line. Okay, anterior axillary line, place your finger along the costal margin, you will appreciate it. Okay, that is how you demonstrate the Hoover's sign. Coming to the next major important sign, that is barrel shaped chest. You all may be very understanding, you all might know this sign. So what happens? Normal anterior posterior to transverse. Okay, anterior posterior is anterior to posterior, that is anterior posterior. Okay, normal anterior posterior. So transverse is, this is the transverse diaphragm. So normally it is 0.7 to 0.75 the ratio. Okay, the normal anterior posterior diameter of the chest and the transverse diameter of the chest is 0.7 to 0.75. So what happens in COPD patient? There is a air trapping. Okay, why there is air trapping? Because of the distal airway collapse. There is an air trapping. So the diaphragm, because of the air trapping, the chest increases in circumference. So once it increases, the anterior posterior diameter increases. Okay, it becomes like a barrel. Okay, it becomes like a barrel. So because of that, there is an barrel shaped chest. So what will be the ratio in barrel shaped chest? Anything more than 0.9. Anterior posterior to transverse diameter ratio more than 0.9 is known as barrel shaped chest. You can see in this figure, this is a normal person. See, the transverse diameter is more compared to the anterior posterior diameter here. See, but in patients of COPD, the anterior posterior diameter is almost equal. Okay, not the same, but it is almost equal to the transverse diameter. Okay, this is known as barrel shaped chest. This is second major important sign. Coming to the abdominal paradox. Okay, don't confuse it with the hoovers sign. This is a bit different sign. What happens normally during inspiration, the chest wall moves outward and upward, correct, and the diaphragm moves down, so it creates a pressure gradient. Once it creates the pressure gradient, the abdomen, it increases the intra-abdominal pressure, so the abdomen moves outside. Okay, listen carefully. Normally during inspiration, when the air enters down and the diaphragm moves down, it creates a pressure gradient. This pressure gradient increases the intra-abdominal pressure and moves the abdomen outward. But what happens in COPD patients? Already the diaphragm is flattened, correct? Already the diaphragm is flattened. So the pressure gradient created by the diaphragm is very less. Okay, the pressure gradient created by the diaphragm is very less. Okay, already it's flattened, so pressure gradient is created is very less. And one more thing is, there is a use of accessory use of muscles, correct? So under the accessory use of muscles like sternocleidomastoid, pectoralis major, pectoralis minor, so all those things tries to move the ribcage up, so there is a bit of more sucking action. Okay, there is a bit of more of sucking action, so that sucking action will cause the diaphragm to move in. It will cause the diaphragm to move in, and further when the diaphragm moves in, the abdominal pressure is reduced, so even that gets sucked in. Okay, let's see in this figure. Okay, this is a normal thing. Okay, B, come to B. When there is an inspiration, the chest wall and the diaphragm moves outward because of the pressure gradient created by the diaphragm. In COPD patient, the pressure gradient created by diaphragm is very less. Once the pressure created by diaphragm is very less, how do you measure the pressure gradient of diaphragm? It is pressure in the abdomen minus the intrapleural pressure. Since the abdominal pressure is almost 0, the pleural pressure is high. The pleural pressure is high. So because of that, the diaphragm gets sucked in, and even the abdominal contents get sucked in. Because of that, during inspiration, the diaphragm and the abdomen moves inwards, and there is outward movement of the chest wall. Okay, clear? Coming to the last sign of today's video, DAHL sign. One of the viewer had messaged it in the comment box. So what happens in DAHL sign is, as we had seen previously in previous video regarding the tripod posture, the COPD patient tried to keep his hand or the extremity on the knees and try to bend forward. So what happens when he stays in that position for a long time? There will be hyperpigmentation of the extremities. Here there will be hyperpigmentation of the here and near towards the knees. That sign is known as DAHL sign. Okay, hyperpigmentation of the extremities because of the chronic assumed posture, mainly in the tripod posture or like any other posture which they assume, is known as DAHL sign. As you can see here, the person sitting here means there will be chronic arrhythmia because of that posture, and you can see here the same on the elbows, knees and elbows. This is known as DAHL sign. Okay, thank you all for patience listening. If you have any comments to be made or any modification or any suggestion, kindly leave it in the comment box. Please like, share and subscribe. Thank you.